The next time you go to the bathroom, before you automatically reach for the flush handle, I want you to stop and take a 5-second look into the bowl. What you see in that water could be the most important health warning you ever receive. It could literally save your life. Your kidneys are two bean-shaped organs, each about the exact size of your fist, tucked deep inside your lower back, just below your rib cage. They are the unsung heroes of your biology. Every single day, these two small organs filter an astonishing 50 gallons of blood. They are your body's master filtration system. Their job is to remove toxic waste, balance your essential minerals, regulate your blood pressure, and flush out excess acidic water. But here's the terrifying reality of modern medicine. Your kidneys are incredibly resilient, which means they are also incredibly silent. You can lose up to 80% of your kidney function before you feel even a single drop of pain. There are no pain receptors inside the filtering units themselves. By the time your lower back actually hurts, the damage is often catastrophic and irreversible. After the age of 40, the modern diet takes a heavy toll. Hidden sugars, chronic high blood pressure, and the everyday painkillers you pop for a headache begin to microscopically shred the delicate filters inside your kidneys, known as nephrons. Once a nephron dies and turns into scar tissue, it never grows back. You don't get a second chance. Instead of filtering toxins out into your urine, damaged kidneys let the poison build up in your blood, while simultaneously leaking essential, life-saving proteins out of your body. Today, we are cutting through the noise. We are going to look at your eyes, your skin, and yes, your urine, to decode the 7 absolute most critical early warning signs of kidney failure. If you have sign number 2, your internal filter is already leaking badly. Let's read the signals before it's too late. Let's start with the most visual and yet most frequently ignored sign. When you urinate, I want you to look at the surface of the water. Does it look like a freshly poured glass of beer? We aren't just talking about a few normal bubbles that pop and disappear within 10 seconds. We are talking about a thick, persistent, white layer of foam that clings to the bowl and requires you to flush 2 or 3 times just to get rid of it. This condition is clinically known as proteinuria. To understand why this happens, imagine your healthy kidneys as a high-quality coffee filter. A good filter keeps the coffee grounds inside and only lets the pure liquid coffee pass through. In your body, the grounds are your essential proteins and red blood cells, and the liquid is the waste. But when your kidney filters are damaged, usually by years of high blood sugar acting like shards of glass, or high blood pressure forcing blood through too violently, the microscopic holes in the filter get ripped wide open. A crucial protein called albumin, which your body desperately needs to survive, slips through these ripped holes and falls directly into your urine. When this dense protein hits the water in the toilet bowl, it reacts with the surface tension. It foams up, exactly like egg whites when you whip them vigorously in a bowl. If you see this thick foam day after day, your kidneys are literally leaking your body's structural building blocks down the drain. This is an immediate, flashing red flag that your filtration barrier is broken. Now, let's move from the bathroom to the mirror. Do you wake up in the morning with heavy, swollen, intensely puffy bags under your eyes? Many people over 40 immediately blame this on a lack of deep sleep, seasonal allergies, or simply getting older. But if this puffiness is chronic and doesn't go away with a cold compress, it is a direct, terrifying consequence of the protein leak we just discussed in sign 1. Here is the fascinating yet dangerous science behind it. The protein. Albumin doesn't just build muscle, it acts like a powerful magnetic sponge inside your bloodstream. Its primary job is to hold water inside your blood vessels so your blood stays thick and pressurized. But as your damaged kidneys leak that albumin into the toilet, you develop a severe protein shortage in your blood. Because there is no sponge left to hold the water physically leaks out of your veins and settles into the loose, empty tissues of your body. Why the eyes? Because the tissue surrounding your eyes is the thinnest, loosest, and most delicate skin on your entire body. When you lie flat in bed for 8 hours, gravity allows that leaked fluid to pool directly into your face. If you wake up looking like you've been in a boxing match and your eyelids feel heavy and tight, your kidneys are fundamentally failing to manage your internal water pressure. This is not a regular, everyday skin itch caused by dry winter air, a cheap laundry detergent, or a bug bite. This is a maddening, relentless, deep itch that feels like it is crawling right under your skin or even vibrating inside your actual bones. You can apply all the expensive moisturizing creams in the world and you can scratch until you physically bleed, but it will not bring you a single second of relief. Why? Because healthy kidneys do much more than just make urine. They act as the master chemists of your blood, specifically balancing complex minerals like calcium and phosphorus. When kidney function drops below a certain threshold, they completely lose the ability to filter out excess phosphorus from the foods you eat. Things like red meat, dairy products, and especially dark sodas. This phosphorus builds up to highly toxic levels in your bloodstream. It then aggressively binds with calcium, creating microscopic, sharp, crystal-like deposits. These sharp crystals are then pushed out of the blood and settle deep under your skin and inside your blood vessels. They act like thousands of tiny needles, severely irritating your nerve endings from the inside out. If you find yourself constantly scratching your legs, back, or arms with absolutely no visible rash or redness, you are not dealing with a dermatology problem. You are dealing with toxic mineral buildup because your internal filters are hopelessly clogged. Have you suddenly noticed that your favorite foods taste completely different? Perhaps a good steak now tastes strangely metallic, as if you are chewing on a mouthful of old pennies. Or maybe your spouse, family members, or friends have gently mentioned that your breath smells foul, specifically like urine or ammonia, no matter how many times you brush your teeth or use mouthwash. This is a very serious late-stage warning sign called uremia, which literally translates from medical Latin as urine in the blood. When your kidneys fail to filter out daily waste products, specifically a substance called urea, which is the natural toxic byproduct of your body breaking down proteins, that waste has nowhere to go but back into your general circulation. This highly toxic, unfiltered blood circulates continuously, eventually reaching your brain and your salivary glands. The high levels of urea in your saliva chemically break down into ammonia gas, giving you that distinct, sharp, foul breath. Furthermore, this toxic neurological buildup physically alters the receptors on your taste buds. It makes you lose your appetite entirely, especially for protein-rich foods like meat, leading to rapid, unhealthy weight loss and muscle wasting. If food has lost all its joy and simply tastes like metal, your body is essentially marinating in its own biological waste. Many people over the age of 40 experience lower back pain at some point. When it happens, they immediately blame a pulled muscle from lifting something heavy, a bad mattress, or a degenerating spinal disc. But true kidney pain feels entirely different from muscular or skeletal pain. Kidney pain does not happen in the center of your spine or down near your tailbone. It happens much higher up, just tucked below your rib cage, on either the left or right side, an area doctors call your flanks. Unlike muscle pain, which sharply hurts more when you bend, twist, or walk, kidney pain is a constant, deep, dull, sickening ache. It feels like an intense internal pressure that simply won't let up, no matter how you stretch or position your body in bed. This specific pain is usually caused by the highly sensitive kidney capsule, the sac surrounding the organ, stretching outwards. This aggressive stretching can be due to a sharp kidney stone, blocking the delicate flow of urine and causing a backup, a severe urinary tract infection that has traveled up into the kidneys, or fluid-filled cysts growing inside the kidney tissue, a condition known as polycystic kidney disease. If you feel a deep, throbbing ache under your ribs that makes you feel nauseous or feverish, your kidneys are physically crying out for space. Are you the person who is always wearing a thick sweater, even when everyone else in the room is sweating? Do you feel an exhausting, heavy, crushing fatigue that a full night of sleep simply does not fix? You might be suffering from a very specific, highly dangerous type of kidney-induced anemia. Most people have no idea about this biological fact. Your kidneys are not just filters, they are hormone factories. They produce a vital hormone called erythropoietin, or EPO for short. EPO is the critical chemical messenger that travels to your bone marrow and orders it to create brand new red blood cells. Red blood cells are the microscopic vehicles that carry life-sustaining oxygen and heat to your brain, your heart, your muscles, and your extremities. When your kidneys are damaged and shrinking, their EPO production absolutely plummets. Your bone marrow, not receiving the signal, simply stops making enough red blood cells. Without these oxygen-carrying cells, your brain feels constantly foggy and tired. You become short of breath just walking up a single flight of stairs, and your hands and feet are constantly freezing cold. This isn't a thyroid issue, and it isn't just getting older. It is your failing kidneys refusing to send the oxygen signal to the rest of your body. Do you find yourself waking up 3, 4, or even 5 times every single night with a desperate urge to use the bathroom? While this can certainly be a sign of insulin resistance, high blood sugar, or an enlarged prostate in men, it is also a classic, undeniable sign of rapidly declining kidney function. Healthy kidneys are incredibly smart and efficient. At night, they actively concentrate your urine, making it darker and smaller in volume so your bladder doesn't fill up. This evolutionary trick is what allows you to sleep deeply for 8 unbroken hours. But when the microscopic kidney filters, the nephrons, are damaged, they completely lose this ability to concentrate urine. They become leaky pipes, just letting water flow right through them continuously, day and night, without filtering it properly. If your sleep architecture is constantly ruined by the urge to urinate, and the urine you pass is pale and watery even at 3 a.m. in the morning, your kidney's crucial night shift mechanism is fundamentally broken. Your brain is being deprived of deep sleep because your filters won't shut off. The most important thing to know is that your kidneys are resilient. If you catch these signs early, you can change the trajectory of your health. The GFR test. Ask your doctor for a simple blood test to check your glomerular filtration rate. This is the only way to know exactly how well your treatment plan is working. Hydration. Wisdom. Don't just drink 5 liters of water. For damaged kidneys, overhydration can be just as dangerous as dehydration. Drink when you're thirsty, but focus on the quality of your fluids. The hidden killers. Be extremely careful with NSAIDs, common painkillers like ibuprofen or naproxen. Taking these daily is like dropping a bomb on your kidneys. Conclusion: your body is a masterpiece of communication. These signs aren't there to scare you, they are there to save you. If you have noticed any of these F whispers, please take action today. Subscribe to Silent Health Signals as we continue to explore the hidden language of your body. Comment below. If you have experienced any of these signs, share your story. It might just help someone else take the first step. Stay healthy and we will see you in the next deep dive.